Hello, this is Lynn Perez, Ruth Powell, and Cam Bean, and together we are going to talk to you about end-of-life planning. By the end of this presentation, attendees should know how important end-of-life planning is, the wishes and treatments a person should let family and physicians know, some advice on how to be prepared at the end of your life, and some of the different legal documents.
Why is end-of-life planning important? Terry Shriver was a young lady who slipped into an irreversible, persistent vegetative stage after collapsed from cardiac arrest at age 27. She was kept alive on ventilator and a feeding tube. Without end-of-life planning, Terry's husband believed that she would not have wanted to prolong her life under this condition. Her parents wanted to keep her alive on artificial nutrition. It took 7 years legal battle to remove her feeding tube. After her death, autopsy showed that her brain was half of normal size. This is why end-of-life planning is important.
While death is inevitable of the human condition, dying badly is not. Wherever you are in life, younger or older, end-of-life conversations are not easy, but they are necessary. Research shows that families are often wrong about what they think their loved ones prefer. For example, a person may want to die in their home and not at a hospital. A person may wish to play their favorite music and have a funeral, or a person may wish to not be buried, but cremated. Planning ahead and making your wishes known will help your family to fulfill your wishes. It is important to start planning before death, allowing enough time to think through your preferences and your wishes, make important decisions, and share them with your family and your loved ones. This gives yourself and your family peace of mind. End-of-life planning is a difficult topic for people as well as families to talk about. Before planning for end-of-life decisions, you need to discuss your end-of-life medical treatments with your doctors based on your medical condition. For example, will you be in pain based on your medical condition? How much pain? For how long? How will the doctors manage your pain? If applicable, how much and how long of life support do you want, such as feeding tubes or ventilators? It is important to discuss the presence of debilitating medical conditions and locations of these medical documents with your family members and place all the important documents in one spot that is easy for you and your family members to remember. When making end-of-life decisions, it is important to know your legal rights. The Patient Self-Determination Act, passed by Congress in 1990, requires that all federally funded hospitals and nursing homes give patients an opportunity to complete an advance directive, which includes a living will and a durable power of attorney.
So, what are advance directives? Advance directives are written legal documents letting people know what kind of medical care you wish to have if you are seriously ill or dying. They are official documents that state for medical care in an emergency or end of life. Advance directives can also be used in the case of severe medical conditions in which you are not able to communicate your wishes or make decisions, such as after a severe stroke or someone is in advanced stage of Alzheimer's. Advance directives should adhere to every legal requirement for the state you live in. In Missouri, it does not require a lawyer to write advance directives, but require a notarized signature. From 2011 to 2016, the Division of Pulmonary Allergy, Critical Care, and the Palliative and Advanced Illness Research Center in Pennsylvania conducted a systematic review. They reviewed 795,000 Americans who were part of 150 different studies and found 63% of them had not completed any advance directive. Only 29% had a living will, and 33.4% had a healthcare power of attorney. A living will is an official document that identifies the level of medical intervention desired by an individual when she or he is incapable of making medical decisions. According to American Cancer Society, before your health team use your living will to guide a medical decision, two physicians must confirm that you are unable to make your own medical decision and you are in a medical condition that is specified by your state law as terminal illness or permanent unconsciousness. Who will make decision if you can't? A power of attorney for healthcare is a legal document in which you name a person to be a proxy to make all your healthcare decisions if you become unable to do so. The person you name as health proxy should be someone you know well and trust to carry out your wishes based on the information provided by American Cancer Society. Before a medical power of attorney can be used to guide medical decision, a person's physician must certify that the person is unable to make their own medical decisions. Health proxy can be your lawyer, family members, and friends. If you choose someone as your health proxy, make sure to notify them. If your wishes in a certain situation are not known, your proxy will make a decision based on what he or she thinks you would want. If you regain the ability to make your own medical decisions, your proxy cannot continue to make medical decisions on your behalf.
A do not resuscitate or DNR order means that if you stop breathing or your heart stops, nothing will be done to try to keep you alive. If you are in the hospital, you can ask your doctor to add a DNR order to your medical record. If you are outside of the hospital, ask your doctors how to get a DNR wallet card or a bracelet. DNR documents should also be kept in a safe place at your home.
In 1968, the United States passed the Uniform Anatomical Gift Act, which sets the framework for the donation of organs, tissues, and other body parts to science, medicine, and education. It's been revised a couple of times since then because there has been a huge advancement in organ transplants, and there's also been controversy with families refusing the donation. The main idea is the recognition of a person's right to self-govern when it comes to organ donation. There's usually a section in Advance Directive for organ donation, and it is also recommended to register through organdonor.gov. Most people only have it marked on their driver's license, which many times the hospitals do not see it in time, and family members have the potential to override it. However, hospitals do check their registry, and family cannot contest it. A brightly colored form, usually in pink, is called the Physical Orders for Life-Sustaining Treatment. It was designed to ensure the full range of patient treatment preferences and to overcome the limitations of CPR orders. This form ensures that patients' wishes to receive or refuse life-sustaining treatments are honored throughout the healthcare system. It can do this because when it comes to medical treatment, it is much more detailed than a living will, and it is signed by a physician, which makes it a medical order. The living will is not. Therefore, EMTs and other medical professionals must honor it. The post is usually divided into 5 sections, as you can see here. It lets a person choose which level of treatments they would like to receive in a medical emergency when it comes to CPR and what kind of interventions a person would want, such as full code, meaning any means necessary to sustain life, or comfort measures only. A person can choose limited interventions when it comes to intubation, such as breathing machines, if they want antibiotics or not, or limited medications with comfort as a person's only goal. There is a choice on receiving artificial nutrition or hydration or not, and all of this, of course, is much more detailed in the POLST form. The final section contains who the form was discussed with, summary of medical conditions, basis for the orders, and physician stated signature. If you are wondering about the implications when it comes to artificial nutrition and hydration, you want to keep in mind we are talking about the end of life. Initially, these treatments were intended to be used for short periods of time until a person with a reversible condition is able to regain the ability to eat or drink normally. According to Dr. Cheryl Aranella, the scientific community took a look at this and found some surprising things. Some people think a dying person who has become dehydrated due to lack of fluids will experience extreme thirst, pain, and distress. The truth is that dehydration in a seriously ill person with a terminal condition or in the frail elderly, it is not painful. And studies have shown that the majority never experience thirst. There can even be benefits to dehydration. For one thing, catheters can cause infections. It also decreases swelling in patients experiencing edema, and then there's less urine output, which means less skin irritation for bed-bound patients. Another false belief is that a person who stops eating will starve to death painfully. The truth is, if a terminally ill person stops eating, it is usually because the disease has progressed to the point that a person is no longer able to process food and fluids. Artificial nutrition and hydration does not help a person live longer, feel better, or feel stronger. In fact, it can make a person feel bloated, nauseated, and sometimes it can cause diarrhea. Kathy Black of Hartford Geriatrics stated that dementia is the 7th leading cause of death among older adults. And with the growing number of people who will experience dementia, there is now a What If I Have Dementia Advance Directive. This is a section of what the form looks like. It gives options for the kind of medical treatment a patient would want for each stage of dementia that they would be in: mild, moderate, and severe. It could be anywhere from wanting to live as long as you can to receiving comfort-oriented care only. According to the Alzheimer's Association, Alzheimer's disease will have a 60% rise from 2010 to 2030, and this is only one of many cognitive declining diseases. This is an increasing challenge of providing financial services to older adults. Now, no one wants to believe that a family member would contest an aging loved one's legal documentation, but sadly it happens all the time. A person can prevent this by obtaining a letter of competency from their doctor when they are doing other advance directives. Having this form on record dispels any notion that documents were created while someone lacked mental capacity to make medical, financial, and legal decisions. It may seem excessive for additional proof of mental competence, but people are living longer with cognitive decline, so obtaining this one form while a person is visiting their physician is minimal compared to the emotional turmoil and family disputes involved in lawsuits and lengthy investigations.
Power of attorney is important for the fact that it is customized for the individual wishes and needs of each person. Having a durable power of attorney allows for stability when it comes to a person's life ending. Determining who to designate for the power of attorney can be difficult, but the most important thing to remember is to assign a responsible person that cares about your wishes and well-being whenever you cannot do these things for yourself. Power of attorney is a person that makes decisions about financial and personal information of an individual, whereas healthcare proxy differs because it designates a medical professional or official to make professional decisions concerning the health of a patient. Having a testament and last will allows for your wishes and preferences to be easily as well as legally met. The actual costs of drafting and certifying this document are not as much as what some people may perceive. With this simple document, a person can save the hassle and chaos for the people looking after them when their life is coming to an end. In addition, finances and who retains what things can be provided in this document, eliminating any confusion when it comes to assets. Finally, the most important reason to have a last will and testament is to be prepared as an individual. Since we all die in the end, why not have a plan for when the time does come around, rather than feeling guilty for the lack of preparation and leaving your family to scramble?
The amount of important forms to complete when planning for the end of life can be overwhelming, so we just want to do a brief review of everything we've discussed thus far. An advance directive is really a broad category of legal end-of-life instructions that can include things such as a living will, a durable power of attorney for health care, a do not resuscitate order, and an organ donation form. All of these documents together serve to let medical professionals know your preferences for care in the event that you're unconscious or unable to speak for yourself. A post complements an advance directive and is generally used by people who have an advanced illness or frailty to specify specific medical treatments that they want at the end of their life. A last will and testament is a legal document to tell others how you want your assets distributed, and a financial durable power of attorney gives someone else the power to make financial decisions for you if you are unable to make them yourself.
Disclosing the location of personal information with the power of attorney is necessary and highly important. When the time does come, keeping things that are personally vital in one spot is important. It ensures that preferences and wishes of an individual are met and clearly defined, as well as easily located. This also ensures that people are notified of a person dying, which includes loved ones for grieving and funeral arrangements, groups that a person was involved in for the same, plus termination of that involvement, and medical professionals to discontinue medication prescriptions. It is important to discuss the location of your financial information with your power of attorney as well. Keeping financial documents in one location is a good idea because it allows for the preferences to be met when it comes to money, and it's easily accessible. Where wealth lies in how wealth and assets are distributed, plus who will retain what, can be determined as long as there is a set plan and your power of attorney comprehends and practices your wishes. If money is owed, the power of attorney helps pay back the debt to whoever is owed, given the assets presented after the time of death. End-of-life planning is very stressful, and there are many things to consider whenever it may come. It can be a lot more stressful and emotional for you and your loved ones if you wait until the last second to make a plan. For more information and how to help get started with your end-of-life planning, begin talking to your physician or visit these sites above. These are even more resources for end-of-life planning, as it can never be too early to begin thinking about having a set plan. These sites are particularly for older adults, but it does not mean younger adults and middle-aged adults cannot be informed on what comes with end-of-life planning.